Hemen Patel, Provost, Parul University, Dr. Abhay Dharamsi, Dean, Faculty of Pharmacy and Principal, Parul Institute of Pharmacy, Dr. Guno Chakrabarti, Principal, Parul Institute of Pharmacy and Research, Dr. Lalit Lata Jha, Principal, School of Pharmacy, Dr. Vandana Patel, Dean and Professor, Doctoral Studies, Parul University, Dr. M.R. Yadav, Director, Center for Research and Development, Parul University, Dr. Dinesh Nair, Hospital Administrator, Professor and Head, Amrita Institute of Medical Sciences, Kochi. On behalf of School of Pharmacy, Faculty of Pharmacy, Parul University, I, Dr. Anand B. Pithadia, welcome you all in a webinar on drugstore management in a university teaching hospital. I wholeheartedly welcome Dr. Dinesh Nair sir as an expert for today's webinar. Beside his busy schedule, Dr. Dinesh has given us time to interact with students and deliver this talk. Let me introduce Dr. Dinesh Nair. It is my honor to introduce Dr. Dinesh. Dr. Dinesh is presently working as the hospital administrator and professor and head of the Department of Hospital Administration at the Amrita Institute of Medical Sciences and Research Center, Cochin, Kerala, India. With more than 20 years of experience in hospital administration, he has specialized in healthcare delivery systems with a doctoral degree and trained at John Briggs Center, University of Adelaide, Australia, on systematic reviews. He also holds an MPhil in labor laws, a green belt in Six Sigma, and also higher specialization in hospital quality assurance programs. His core area of competency include hospital operational analysis, utilization reviews, hospital analytics, planning and design, project processes, and has numerous publication in leading international and national journal. So with this, I would like to request you, sir, to please start the session.
Thank you very much, Dr. Anand. Really privileged to be here this morning with such an august gathering. I hear the name of senior management officials and faculty members from Parul University. Very good afternoon and a warm New Year wishes across to all of you. Thank you very much, Dr. Lalit, for giving me this opportunity to interact through this webinar on a virtual platform with your students. As Dr. Anand mentioned, my core competence is actually in operations. Hospital operations are very dynamic and complex. And in a university teaching hospital, the role of pharmacy and pharmaceutical sciences has made its marks in as far as outcomes are concerned for patient care. I have prepared since this topic on drug house or drug store or pharmacy management is a wide area. I hope I will do justice in my presentation, which is largely didactic, but I am told that the students are largely from the PharmD, B.Pharm diploma students. So I have tried to make it a little interesting with giving it a theme of the movie Sholay. Little bit, but I will not make it dramatic. Let me assure you that. So once again, I thank Dr. Lalit and her entire team, and I hope you will all have relevant interactions when we start the presentations. So let me share my screen. Dr. Anand, can you see
Yes,
me
sir.
here?
Visible. Yes, sir. Visible. Perfect.
All right. So, with due respect to all the dignitaries and on the virtual platform, I would like to present a small presentation. I hope it is a large number of slides, but given the time frame, I would try to do justice to this presentation. I'll quickly take you around what this campus is all about. You see that that's the place we are in. It's Cochin, the central Travancore part of the peninsular India called Kerala, and that is our campus. It's a basically the project under the Mata Amritanandamai Mutt, where our chancellor Devi Mata Amritanandamai Devi had uh, uh, constructed and commissioned this 1,300 bed quaternary care facility for the welfare of the people across India and around the world. She had personally defined the vision of this large hospital, that is to provide healthcare of the highest quality to all in a spirit of compassion and continually to improve the standard of care provided to the community through promotion of value-based quality education and research. This is what the campus is all about. It houses the School of Medicine, School of Pharmacy, School of Dentistry, School of Nursing, allied health institutions, and the likes. A quick statistics of this campus spread across 125 acres with approximately 33 lakh square feet building of square footage of building. It's a 1,300 bed quaternary care university teaching hospital, which also has a 250 bed extended care facility, 31 state-of-the-art operation theaters, 275 acute care beds, approximately 45 departments, more than 1,200 full-time faculty members, approximately 4,800 staff, and we are well connected on the telemedicine grid. If you look at the activity, which should be relevant to pharmaceutical students, we have an annual outpatient load of approximately 10 lakhs, more than 1 million outpatients. That's what we see. Now you can reflect that onto your turnover of pharmacy. We treat approximately 68,000, more than 68,000 patients in the inpatients, and roughly around 30,000 surgeries on an annual basis. So that is at any level, this is one of the staggering figures that you can see across any healthcare systems at a quaternary level where you treat higher specialized care. This all has an imbibing on the way you deliver or provide medicines. Quality goes across with healthcare today, and it has become a norm. As most of the centers, we are also accredited by NAC for academic programs. For operations, we are accredited by ISO, NABL, NABH, and the likes. We are one of the top 5 hospitals in the country for cardiac care and cancer treatment. One of the largest centers for solid organ transplants in liver transplants, kidney transplants, small bowel transplants, bilateral hand transplants, and you name it, we have it here. We were the first to implement the PAC system, or the picture archiving and communication systems, in Asia in the year 1998. That makes us the first hospital in India and Asia on a paperless, filmless process. We were the first to implement the electronic medical records in India, and we are ranked the 6th best medical school in the country. These are the large number of undergraduate programs that we run, more or less 20 undergraduate programs, approximately 91 postgraduate programs. Those are all our allied health programs. So with that brief introduction, let me come to this topic of drug delivery system, or is it? So that's why I just put it here, just a perspective on what exactly we do here as far as drug delivery systems are concerned. I am sure most of the leading faculty members at Parul in pharmacy, they know in and out of pharmacy operations theoretically. It's what we do here that matters. So this has become the new normal. You have the COVID virus there, and you have the virtual platform actually satisfying all your academic programs. And this is one of the best way that I felt that we can interact. No doubt, approximately 2,500 kilometers down north, and I'm able to interact with a large number of faculty and students. All right. Now, coming to pharmacy drug delivery systems, I feel that any decision that the pharmacy industry takes, I may be wrong, you can correct me. Any decision that the pharmacy industry takes on a product, a technique, or a piece of equipment has a direct practice management ramification on things like cost of the drug, the medicine, outcomes, efficacy, efficiency, patient satisfaction, overhead control, and direct clinical applications as well. With that opening word, I would like all of you to think, is this what it is? For the young students, I thought I'll just put in a few words which you might have already learned in your first semester or first year. What is pharmacy? It's an art and science of preparing and dispensing drugs, right? A retail shop where you get your medicines, where you can sell it at a retail cost. Is it the art or practice of preparing and preserving drugs and compounding and dispensing medicines? Yes, it is all. It's a place where medicines are stored and compounded and dispensed. So that brings me to this slide, which I personally feel as an administrator or as a manager, that a pharmacy to me is a strategic business unit. It is an SBU, and it is very important to me. The operational efficiency of a pharmacy system or a drug delivery system within a quaternary care university teaching hospital defines how I can sustain the clinical program. For those who are thinking that hospitals are largely viable, hospitals are made sustainable only because you have certain strategic business units like the lab, a pharmacy, the procedures that offsets your cost of care. And accordingly, if you look at a strategic business unit perspective, what does it entail? It entails only three things: procurement, storing, and dispensing. Yeah, that's it. Is it? If you further define it, you will see that it involves collecting, assessing, planning, implementing, and following up on your strategic plan for developing and running an operational drugstore management purpose. That is where we say that we have the stakeholders, a lot of people. This is a Photoshop of the famous character cast for the movie Sholay. All of them, be it Thakur, be it Jai, or be it Viru, they all played their role perfectly so that we enjoyed that movie. Similarly, a lot of stakeholders involve the pharmacy industry that sync together and gives you room to operate in an efficient manner. So within this industry, what do you see? You have the pharmaceutical companies, you have patients in the hospital, and you have young group dynamic people like pharmacists who run the show, and that makes the industry complete. As far as we are concerned, in a large setup, here we have 50 departments, more or less 50 departments, around 40 clinical departments, dispensing of medicines to patients in their OP, in the IP, in different locations is definitely a challenging task. At the same time, you have to maintain operational efficiency and cost efficiency. So this draws you to a small, a pretty complex organization chart, which defines the 5 verticals that you see. So you have the pharmacy drugstore management system that has an administrative training part on one side. You have the inpatient pharmacy, you have clinical pharmacy, you have outpatient pharmacy, and then you have stores and supplies. So I have given the verticals very clearly. I will not dwell into the nitty-gritty of the org chart, but if any clarification at this point is required, I am happy. With that sort of complex organization chart that draws its web across the clinical departments of 40, it is a headache. It is really a complex machinery that needs to be well oiled and run smoothly. And often, that's not the case. You always have a problem, this or that. The standard processes are very easy. The clinician, what does he do? He diagnoses the diseases. He prescribes the medicines. The medicines prescribed are ordered and billed. It is authenticated. Medicines are certified. It is verified, supplied to the patient. Case closed. What do you hear? This is what happens when we are usually in for these sort of comments and severe criticism that medicines are costly. One thing. The side effects is that you will run bankrupt. And not only here, any part of the country you see, you will hear that unless medicines are free. As we all know, there is no free meal anywhere. You have to make your management lessons chiseled, and that is where you see Viru and Vijay both are saying, "Ab to kuch karna padega." So this is the famous dialogue that you say, "Kitne aadmi the?" So what does that mean? Here you will see that Gabbar is actually trying to analyze the situation in a way that no other management person will be doing it. He's trying to understand the situation, how to analyze and take an action. And in a hospital setting, you have the managers who are actually running after you to come up with better performance, more activity, more turnover. And in an institution like us, where our volumes of OP per day is approximately 4,500 OPDs and 1,100 IP, our people in pharmacy run crazy. With turnovers touching around 100 CR a month, it's a big complex game. If you recollect the last few slides that I said, it's always a challenge for us to ensure operational efficiency. We often try to understand the operations from the patient's perspective. They always keep complaining that I've been waiting for such a long time, I'm not getting my medicines. I'm not getting the medicines that the clinicians prescribed. The drugs are so high here, costly here. I can buy it outside. Now, some of these are real management problems, and we try to analyze it from the management perspective. We collect data, and this chart exemplifies that particular thing. It is called a Pareto chart, where we try to understand what is the average waiting time that we see in a clinic, that in an outpatient facility in a clinic, and what is our benchmark. When we say we have a benchmark that any patient who has been seen by the doctor and medicines are ordered, a patient with more than 10 medications, we call it large volume. Less than 10 is low volume. And we try to understand how much time it takes. This slide shows, based on the feedback of the patients, we did the study, and you can see on the top end chart, at the peak, during the peak time, you will see that low volume patients are waiting up to 89% of the scheduled time. And on the linear axis, you see the activity. Similarly, during a normal time, you will see that the low value medicines are fairly easily given out. Now, how do we make and assessment of that. That is where we did a fishbone analysis, where we took all the stakeholders into the 4 categories of people, method, environment, and management, and tried to see what are the major reasons for high waiting time for dispensing medicines. We had a brainstorming session of all stakeholders, including the clinicians, the pharmacists, the assistant pharmacy assistants, the store people, everybody. And we looked at the dispensing speed, where we could see that only 4% is the waiting time or the speed for the prescription to be generated. And maximum time we see is for high value picking that takes time. So we advised the management that we have to never can underestimate our competitions, and we have to be at the top. We cannot do the mistake that Gabbar did of leaving away Thakur with his limp. So this is what I say, hello, I am accountable. And the outcome information here is that the cycle time should be standardized. And we felt that a prescription with 4 to 6 medicines should be delivered to patient in not more than 45 minutes. But given the same thing, it is up for criticism that a medicine that is only 4 to 6 in numbers, should it take 45 minutes? But in a busy OP, what are the number of counters that you keep has to be financially sustainable. Other recommendations were like, in time for trolleys for delivery of medicines, time taking from prescriptions to coming from the ward and the ICUs, and medicine should be taken in FIFO order. That I will come to later on. And it also gives you one more information that during peak time, there will be 20 to 30 medicines waiting in the queue. So if you do LIFO sort of dispensing, it is resulting in delay. So we need to be careful about that. So we try to ensure that drugs are dispensed properly to the patients. There is an appropriate system for dispensing drugs. And these are all the standard listed thing that you actually do to dispense things. I would like to take you here to one of the methods that we felt is efficient in our system. That is the Amrita Pharmacy Information Management System. Now, this has been our case since last 18 years. We have been using this module, the pharmacy module, which not only helps in storing data across the hospital information system, but also enables us to functionally organize and maintain and process the activity in the pharmacies within Amrita Institute. Our pharmacy information system is part of our Amrita Hospital Information System, which is integrated through the HIS by what you call the CPOE, or the Computer Physician Order Entry System. It helps us manage different functions at a pharmacy store, be it billing, invoicing, recording, prescription, accounting. I'm sure most of you students and faculty are aware of it, the pharmacy software. I will not dwell much. Just to highlight a few of the silent features, it helps you far, far better than managing it with manual recording in purchase management or sales management or report generation or order calling or e-bill, to an extent that even GST return can be filed easily. It also helps in safe and effective dispensing of drugs, and also helps in promptly to helps the pharmacist to verify the medications, see that the correct medicines are given at the correct dosage, and correct information passed on to the patient. It also helps to offer a clinical decision support system, not only to the clinicians, because it has an inbuilt formulary system, which actually is our own in-house formulary, which is ratified by the pharmaceutical therapeutics, pharmacy and therapeutics committee, and updated on a regular basis every 6 months based on the requirement of the clinicians. So it also has an inbuilt partial artificial intelligence that helps the clinician to zero in on the particular drug of choice that can be given to a diagnosed disease. So we all draw strength from this system, and I'm sure you will also find large number of advantages of the management system. So as I said, it's a lot of didactic, but I will just highlight a few. It helps you in an efficient workflow. The moment a prescription is generated in any clinic in our hospital, it immediately is printed in the pharmacy of the nearest sub-store. And the patient can go there once it is billed and he can collect. So it increases the efficiency, operational efficiency, brings in more accuracy into the system. Having said that, we were also happy to note that that digitization of the system also brought in a level of customer satisfaction. As soon as the medicines are ordered, billed, and prescription generated, it reaches the pharmacy store and it is dispensed and packed. And the pharmacist keeps it there, and by the time the patient comes down from the OP to the pharmacy, his medicines are ready. See, as long as non-peak hours are concerned, the patients are very satisfied. Let me be very frank. But during peak hours, the system still is challenging that we are looking at 30 to 40 minutes of bulk prescriptions. Compliance is another thing that we are all looking at, and your system is only as good as you try to market. As Jay does try to convince, and as Basanti takes care of her fellow traveler, we also take along all our faculty and staff in ensuring that our major divisions of Department of Pharmacy works in a well-oiled manner. I have given the broad 5 divisions of pharmacy. I'm sure most of you must be aware of this: administration and training, outpatient pharmacy, inpatient pharmacy, clinical pharmacy, stores and supplies. So I will try to quickly go through it and what we do in administration and training. So we have a chief pharmacist. Under him, there are senior pharmacy assistants and pharmacy assistants. And below them, there are sub-stores, storekeepers, store assistants, clerks, and attendant. And what they do, they go through a large number of official correspondence that come in from vendors, that come in from clinicians for new molecules, new drugs of choice. They also are responsible for allocation and expenditures for the pharmacy department. They schedule the meetings for the committees, including all stakeholders from different departments. And they also come out with plans for future plans. This is also one department that takes care of training, where all our pharmacists, from diploma, degrees, masters, trainees, clinical pharmacists, they undergo training, and this department is responsible for that. And we follow the guidelines as set up by the PCI, the Pharmacy Council of India. I'll come to the workflow of OP patients that we follow here. It must be it might not be a very standard process, but this is our policy as far as outpatient issuing medicines to the outpatients are concerned. The prescriptions are taken, it is kept in a tray beside the billing partners, and then it is billed. Then the required amount of medicines are taken from the medicines rack. It is kept ready in the dispensing table. The medicines are checked. The instructions are written on the outside cover of the pack. The medicines are dispensed to the concerned patient. And if it is from the casualty, it is the same process. It goes to the same dispensing area in the ambulatory block. Medicines that are issued to the OT, this lists some of our major OTs 1 to 11, and it includes large number of narcotics. So what we do is we have kits that are prepared for each OT in terms of medicines required, drugs required, and it is handed over to the anesthesia technician. A daily OT issue register is maintained and signed by the anesthesia technician upon receipt of the specified kit. At any time, if these kits get exhausted, then they can approach the pharmacy substore along with the empty ampules for replacement. Same thing with the issue of medicines to the ward. The staffs representing wards, ICUs, approach with 2 copies of the indent, 1 in duplicate. They verify the accuracy of the narcotics usage and the number of ampules, transfer the stock, replace the empty ampules, ensure that the accurate quantity is issued. We also have large number of procedure rooms, be it the dialysis or be it the substores in radiology, pain and palliative, lithotripsy in gastroenterology, endoscopy room in the gastromedicine, oncology, where you have clinical pharmacists for mixing medicines. So they all follow a set policy as formulated by the Department of Quality Control and as per the manuals given in the quality guidelines. I just listed some of the workflow processes. We also have a sort of quote unquote a hotline service which actually addresses the issue of some important medicines which run out in the pharmacy. So there is a provision that any doctor can ask for a hotline services which is functioning in one of our tower called 50, that is the 5th tower ground floor, and he can ask for a particular service, medicines to be made available. In case of inpatients also, it is the same process. They are directed to the hotline services in the ground floor of the 5th tower. The request then forwarded to the purchase department, and on arrival of the medicines, the patients are informed and the billing process is completed. We also have something called the home delivery or the courier services of medications, and as per your requirement, it is delivered. There are certain limitations for pre-deliveries based on the value that covers your cost of travel, and the billed amount can also be couriered to them. Our policy clearly defines the narcotics policy and how you store and dispense narcotics to the patients. I will not read through it. I'm sure you will be aware of it. In case you need it, I can send it back to you. This is a picture of our 24-hour OP pharmacy, which shows a very nicely and neatly stacked medicines in the store and area for the patients and the bystanders to sit down. So one thing that you can see is that the counters somehow are not crowded, which gives you a sense of satisfaction, saying that our systems are working and patients and bystanders are patiently sitting there for their turn to come. So usually our outpatient pharmacy is divided into 3 parts, that is a dispensing service, production and pre-packaging services, and the patient counseling services. Almost all of our pharmacies are sub-pharmacies are located close to the clinics, and the service timings are predefined. In addition to receiving a prescription and dispensing the drugs, we have something called the express counters and caring counters. The express counters are meant for sometimes we run into emergencies, and there might be prescriptions that comes into the respective sub-pharmacy from a clinic for emergency medicines due to some emergency clinical care required in the clinics. So we have an emergency counter there. You have caring counter where larger part of the geriatric populations who find it very difficult to wait, they are given priority and their medicines are given off. We also have a pre-packing section as well as a manufacturing section, largely in oncology department, where we have cancer treatment drugs which are given to the patients after manufacturing as and when required. I'm sure you might be knowing about that. We also have counseling services. This is also a very important part which we emphasize, that our pharmacist or assistant pharmacist, they make sure that they are giving the correct dosage, the correct medicines to the patients, and counseling them how to take that medicines. Are they clear what, by how and when these medicines are supposed to be taken? And of course, there are also issues of medication compliance that counseling helps to a larger extent. We have also done a study on this, whether counseling helps in compliance of medications by patients when they go back home. So that is a photograph of our OP pharmacy. Similarly, we have inpatient pharmacies in almost all the wards and or near all ICUs and even near the operation theater block. So we have something called the ward supply pharmacy and a satellite pharmacy. The terminologies are sufficient to explain that. So ward supply pharmacies basically supplies intravenous solutions and disinfectants directly to all the wards. This section covers supply medicines to the units which are not covered by satellite pharmacy. Satellite pharmacies, on the other hand, is special units which are located near the ward and is also called the practicing unit of, and follow the unit use of a system. Under this system, the supply of medicine is based on the need of the individual patient, which is requested using patient drug profiles. So based on the clinician's recommendations, and if the patient requires a unit dose of a particular medicine, that is also made available. Now the objective is to supply all the drugs and disinfectants also to the wards and units, but it is also to centrally control the supply of medicines, of having a store that can be supplied by a larger store that is stocked outside. Then I will come to the clinical pharmacy part of it, which is also we have in the largely in the outpatient as well as in the inpatient facility. So where you have the TPN or the total parental nutrition that is provided, therapeutic drug monitoring that is done by the clinical pharmacy people, any cytotoxic drug constitutions, and also looks after the drug information services. I will not go into the, in the interest of time, I would restrict myself to the major part of the slides. Maybe you can just have the major objective is to optimize drug therapy, improve drug efficiency, minimize the drug toxicity and the side effects, and determine that the patient is on a long-term compliance of the medications. Here, the objective of the cytotoxic drug constitution to ensure that all such doses are aseptically prepared and all precautions are taken to maintain the sterility of the product and at the same time minimize the exposure of these agents to the staff. We have a well-developed drug information center, and we also have a nicely developed continuing pharmacy education process. So drug information, you ask for any information regarding the drugs, you can have that information at the fingertips. You will always get the pharmacy staff who will get back to you with the particular information that you need on any drug-related issues. They are also entrusted with the task of regularly updating our in-house hospital formulary. They are also responsible for cataloging any reporting of adverse drug reactions, and they also are responsible for ensuring a continual education program for the pharmacy staff. It is the same that I mentioned earlier. The other part of the pharmacy drug management system is the stores and supplies. The aim is to ensure that there is zero shortage. Having said that, that's not always the case. The stores largely we have sub-stores, we have main stores, we have material stores, and main stores actually supplies to the sub-stores within the hospital, and sub-store supplies it to the satellite stores within the clinics. That's how our workflow is. I'll skip that to the objective. It's basically to ensure that adequate and continuous supply of drug and medical items is provided at the affordable and minimal cost within the delivery period. Provide appropriate manpower and facilities for purchasing medications, storage, and distribution of items which are intended by the clinics from the hospital. To ensure that goods are safely and efficiently stored in accordance to the hospital policy and guidelines. We have set up an excellent infrastructure and facilities to ensure that our storage of medications and drugs are at par with international standards. It is clean and well organized. The refrigerators are up and working. They are properly monitored for their AMCs and as well as regular maintenance services by the biomedical engineering department. The refrigerators are clean and well organized. Temperature controls are properly documented and maintained, and no non-medical items are found in unrequired areas. These are all basically the documentations required for a proper upkeep of a store. I'll skip that. Store conditions also, I will skip that in the interest of time. But here I would like to just ensure that we have to ensure that the store is free of pests, it is tidy, supplies are neatly stored, narcotics and psychotropic drugs are double logged and properly maintained with a register. Tablets and other dry medicines are stored in airtight containers. These are something that we largely miss in a busy hospital. Inventory control is one major management issue that we have always been facing, because it is always very difficult to ensure that you are tallying with your stock and with your dispensing quantity, and it always doesn't match. So somewhere something happens. It could be oversight, it could be pilferage, it could be anything. So inventory control of drugs are very important, and the stock monitoring should be done every day morning. We ensure that our stocks are monitored every day in the sub-satellite pharmacies. Consumption of the stock is verified by the night staff and submitted to the store in charge. Stock reports are prepared by the night staff by Sunday night and submitted to the store in charge on Monday, whenever there is a weekend. Indents are created on time for weekly intent, Friday night, and submitted to the pharmacy main store within the allowed time frame. I will skip some of those. The other thing is that the importance of maintaining registers. All our, even the walk-in refrigerators or walk-in coolers are very important for drugs when you maintain your drugs that requires temperature control. A temperature register is very important. The temperature of the fridge or the walk-in coolers are monitored twice a day, recorded in a specific register, and maintained properly. Some of the Schedule X drugs, we have very clear registers for the prescriptions and dispensing, which carries the MRD number or the medical records number, name of the drug, ordered quantity, and signature of the patient is obtained. Transfer and issue reports are separately filed and kept safely. Managing drug supply is another challenge that we have always faced. But with the pharmacy information module, this has been largely computerized in the sense that it always triggers us which medications is reaching a reorder level, whether you have a buffer quantity, whether the medicines is reaching a ordering level. So we are always aware of that. But having said that, we also have problems when the vendor or the dealer or the supplier runs out of stock and your reorder levels goes further down. So we ensure that maximum stocks are calculated for each and every drug and entered into the system. We also maintain in the major store a stock card, so that we know that manually also we have the maximum stock entered. Orders are placed as soon as the reorder levels come in and triggered by the system. Quantity to order formula is used when ordering. All orders are placed using a prescribed format as per the policy of the hospital. And all informations on that format is complete, accurate for ordering. Similarly, we have a central receiving area called the CR, which makes sure that the drugs are received in a timely manner and properly intimated and stored as required. We follow proper procedures for receiving supplies, proper documentations are done, conditions of the boxes are checked, deliveries are acknowledged and dated on the standard format, delivery person signs before leaving the facility, supplies are received and matched with the indented form, expiry dates are checked, short expiries are flagged, and prompt and proper actions are taken for deterioration of drugs received and when is suspected. I'll skip that. Stock cards are one important things. Even though you are on a pharmacy module information system, stock cards are important part of the pharmacy and drug store management system, because given the present scenario and the volume of activity that we do, the major store and the material store requires that stock cards are maintained for accurately keeping a tally on the stock of the items that we have. It is regularly monitored and inventories are checked at least twice a year. With those words, I will leave you with this happy, cheerful photo of the Indian cricket team, that a well-oiled team can accomplish an uphill task of maintaining a winning streak. Having said that, I'm sure that capsule of knowledge that I shared has bombarded you with a lot of information in a small volume of time. But I would be happy if some part of it has been assimilated. I thank the faculty and hope that your students come back to your contact classes very soon, and hopefully not with the COVID virus. Thank you all for a patient listening. Om Amriteshwari Namaha. I am happy to take questions.
Good afternoon, sir.
Now the session is open for question and answer. Yes, please, sir.
Yes. Good afternoon, sir. I am Dr. Vivek Srivastava, and I learned a lot from your presentation, sir. Because it is largely untouched area, and I enjoyed it very much. Sir, while you are giving your presentation, you told us that there is a waiting time of say 45 minutes, particularly in the peak hours, and there is a patient waiting, and the patient will report that there is a lot of waiting and the cost of the medicine is also high. And sir, you also told that you are also having a counseling center also for the patients at your premises. So sir, is it possible that during the waiting time, if we counsel the patient during those 45 minutes, then the patient will not be reporting about that I have to wait so long for the medicines?
Fairly taken, Dr. Vivek. That's a nice point that you have mentioned. We did exactly that. We have an ambulatory block on the first tower. It's a 5-floor basically OP, ambulatory floor. And the lower floor is endocrinology.
Yes, sir.
And diabetes. So we did exactly what you are saying, dot on. Their medications are ordered on the system. The pharmacy information system orders it. They pay for the medicine and they wait in that waiting area. It is at that point that a diabetic educator comes into the picture and she explains how to take insulin, what dose to be taken. And she has a very well-prepared script that she runs through. But that is a very, very encapsulated lecture or a stand and deliver sort of interaction with the patients in the ambulance block waiting area near the pharmacy. But still, what we are seeing is some of our departments are heavy activity, sense, and follow a unit system of outpatient care. So there will be one unit in a OP. For example, the Department of Cardiology. And we have higher specialization. So, for example, if it is a pediatric cardiology OP, you have approximately one unit that is a professor, an associate professor, an assistant professor, and a senior resident. So you have 4 people, and there are approximately 150 patients. So more or less 80% of that patient generate a prescription. That is the thumb rule that we see. 80% of your outpatient volume will generate some kind of a prescription. Now, if you have 150 patients, you are looking at approximately 120 patients generating a prescription, and 4 doctors are generating it. So, given a window period of 8 hours of working, these disease groups, or what we call DRGs, disease-related groups, complex medications. It might not be just one-off medicines. They have a list of medicines that run through, from hypertension to cholesterol to lipid profile, whatever you need. And that is where, when during the peak time, that is 8:30, the physician comes in till 11:30, 12. A large number of crowding happens. Out of the 150 patients, even though you have scheduling large number of patients, and then that is when we have a problem of waiting time. So the question they ask me is, can we have more number of counters at that point? But there is a limiting factor of how many counters as an administrator. So it's a challenging task. And that is where we try to reduce some way or the other the waiting time, keep the patient engaged, as you rightly said, and give them some counseling. Yes, we can do it at the point of delivery of medicines.
Because, sir, this is one area where the pharmacists, they can get opportunity if it is well developed then.
Yes, pharmacists also, but I said a specialized area of endocrinology where there is a sort of a trained counselor who is also a pharmacist.
Okay.
Need not be a post B Pharm, but there are always diploma pharmacists, pharmacy assistants who are trained in this particular niche area of counseling. So they take a long time to train, and once they are trained, they do a wonderful job. Your patient satisfaction immediately goes up, and they are and patients feel outspoken. They are more and more eager to know more about the medication than drugs. So your counseling actually helps you to ensure compliance of the medicines. Yes.
Sir, for the vaccines and other biological products which are to be stored at 228 degrees centigrade, do you have certain other procedures also? What you told in the...
We have something called as walk-in cool rooms.
Okay.
These are basically, since we are a large facility, these are basically 3 rooms. You know, it's a 3 meter into 3 meter, approximately 10 feet, 10 feet, 10 feet. These are chiller rooms, which has double monitoring system at the ground floor, in which we keep highly valuable medications, like each vial of some of the medications are costing you 2 lakhs. We have medication drugs from Spinraza, which costs one entire treatment of that Spinraza treatment for a patient costs around 15 CR. So these drugs are stored in these what we call walk-in cool rooms, which are monitored round the clock for chiller, which has dual compressor chillers, and on a default mechanism, if one chiller plant goes off, automatically the second chiller plant ensures that the temperature is maintained between -2 and 8 degrees. Yes.
And sir, what about these biologicals? They're coming down from the stockist to the hospital.
There are some of the drugs what we do, like for our biologicals that come from the Center for Reproductive Medicines. It has a small window shelf that is directly given by the vendor, but it goes through the central receiving.
Okay.
But it doesn't go into the store per se, but it goes into the central receiving. It is documented, entered. The bills are directly going directly to, and the medications directly is checked in the CR. It is documented and goes to the clinic for immediately providing, because it is dependent on the cycle. So some of the medications, biologicals are going directly to the clinics as and when required by the clinicians. Yes.
Thank you, sir. Thank you very much.
Yes, any other question from faculty or students? I think there are no questions right now.
Oh, that's great. That's great.
Okay.
I think they were bombarded with a lot of information in a small capsule, so they might have felt lethargic. So I try to put in a little bit of a Sholay there, so that they don't sit back and doze off. I hope that helped.
Yes, sir. Okay, thank you, sir, for the topic you have covered during this webinar. That will be again very beneficial to all the students and the faculty members. Parul University organized such expert webinar for the benefit of students and society. So as a token of appreciation, we would like to present a e-certificate to you, sir. So just I am sharing my screen right now. So is it visible, my screen?
Yes, I can say it. Yeah, thank you very much. That's wonderful to have such a great association with Parul University, and really privileged. Thank you very much, Dr. Anand, Dr. Lalit, and the faculty and the students.
Welcome, sir.
Thank you very much, sir.
Okay, so
Thanks for coming.
Thank you, Dr. Lalit. Thank you very much. Thank you. Really appreciate that.
Thank you, sir.
we will mail you, sir, the certificate through your email ID. And feedback form link is shared in the PU webinar page in the Facebook, and also shared in the chat box of current meeting. So with this, I conclude the today's webinar session. Thank you all.
Thank you, Dr. Anand. Thank you very much.